Welcome to our second Resource and Wellness webinar of the year. Humana and the American Diabetes Association have partnered to bring live, interactive webcasts throughout Illinois. On today's webinar, our experts will discuss diabetes and vision care. My name is Dr. Daniel Corboy, and I am the Chief Medical Officer for the Humana Illinois Medicare Medicaid Alignment Initiative, also known as MMAI for short. MMAI is a health plan program for people who are eligible for both Medicare and Medicaid and is available statewide in Illinois. MMAI is a voluntary program that allows those eligible to receive all their healthcare services through one managed care health plan. We strive to be present in the community to break down barriers in communication between members, community groups, provider groups, and managed care organizations to best serve our members. Thank you for joining us, and I hope you enjoy today's presentation.
Good afternoon, and thank you for joining us today. I apologize for the delay. My name is Rebecca Johnson. I am the Corporate Development Officer for the American Diabetes Association, Illinois and Wisconsin markets. I'd like to thank Humana of Illinois for our Resource and Wellness partnership and for making this webinar possible. I would also like to thank our special guests for taking time out of their busy schedules, although they're having some technical difficulties logging in. And I hope that they are here shortly. During today's webinar, if you have any questions for our presenter, please put them in the chat or the Q&A section. This webinar is being recorded and will be uploaded to the ADA Illinois website along with the other Resource and Wellness webinars previously recorded. Let me check on our guests. Dr. Lindsay Chun, who will be joining us shortly, is a senior resident physician in the Department of Ophthalmology at the University of Chicago Medical Center. She is a graduate of the University of Chicago Pritzker School of Medicine and University of California, Los Angeles. She is originally from the Koreatown neighborhood of Los Angeles and enjoys talking with patients of diverse backgrounds and their eye health in connection with the rest of their health. She also enjoys gardening, plant-based cooking, and learning about different cultures through food. After residency graduation, she plans to pursue a neuro-ophthalmology fellowship at the University of Iowa. Thank you for joining us today, Lindsay. I'll kick it over to you to start the discussion. Hi, Lindsay. Can you hear me?
Yes, sorry for the delay. A lot of weird connectivity issues here, but
Well,
thank you for your patience. Thank you everyone for joining today. So hopefully the connection issues don't persist, but yeah. I'll start by introducing myself. I'm Lindsay Chun. I'm a fourth-year resident, senior resident at University of Chicago in the Department of Ophthalmology. And Dr. Hariprasad and Dr. Ghana asked me to help with this panel to talk to people about diabetes and how it affects their vision and their eyes. Dr. Ghana is unfortunately still in surgery. It's sort of a prolonged case. So I will have very last and talk about questions you guys have and about diabetic eye disease in general. So should I just get started?
Yeah, just jump right in. I'm going to go off camera and let you run the show.
Okay, great. So you guys probably know diabetes is like a systemic metabolic condition where a person's overall body is essentially not able to absorb and utilize sugar molecules appropriately, which is very much needed for metabolism for like everyday functioning. There are different types of diabetes, as you know. There's type 1, type 2, sort of like adolescent onset, things like that. But essentially the bottom line is there are sugar molecules that are like in the body, in the bloodstream, that's not able to be appropriately absorbed, energy production. And so with these sugar molecules abnormally kind of floating through the body, you can sort of think about it that way. It can cause different problems. It causes essentially microvascular abnormalities. And so the small blood vessels through our body that provide oxygen and nutrients to the tissues that need it are not able to appropriately deliver the energy as it should. So the blood vessels themselves start developing abnormalities. So the walls of the blood vessels end up becoming kind of leaky, and essentially the fluid that should be contained within the vessels end up sort of leaking out, and that can be seen in the eyes as well. So maybe I think we didn't prepare slides, but I can pull up photos and maybe share my screen and look up like different photos of the manifestations of diabetes in the eyes too. With the eyes, what high levels of sugar that's not well controlled can do is several things. Number one, they can cause the formation of cataracts in the eye. So cataracts are when the lenses inside the eye start becoming a little bit cloudy and cause vision issues over time. So when that lens starts becoming cloudy, it also becomes stiff and a little bit dense. And so it's sort of like looking through a dirty car window. And so that causes vision issues down the line for people. People who have diabetes can develop cataracts a little bit sooner than if they did not have diabetes. The other thing that can happen is retina issues. So the retina is a very thin tissue in the back of the eye. It sort of acts as a film of the eye. It captures the information from the outside world through our eye, kind of like the way a camera would. And it captures that image and it sends it through our optic nerve, which connects our eye to our brain. And then our brain eventually gets the information and sort of processes it into something meaningful. So the retina is a structure within the eye that can also develop a lot of abnormalities. It has a lot of blood vessels because the retina is a very metabolically active part of our body. And so it relies very heavily on like a good, robust blood vessel system. And so if you have like leaky blood vessels or blood vessels that are not appropriately providing the nutrients and oxygen and like sugar molecules the tissue needs, then you will have problems. You'll get swelling of the retina, you'll get abnormal blood vessels forming in the retina, and that leads to things like diabetic retinopathy and diabetic macular edema, which is the swelling of the eye. The macula refers to the center of the retina. So there's a very specific part of the retina, which is the back part of our eye, that captures our central vision, kind of like the central 5 degrees of our vision. And so if any part of that retina is affected, then you will certainly have vision issues. So that's sort of like a brief overview of all that. I think. So I just wanted to talk about like the epidemiology of diabetic eye disease, diabetic retinopathy. So the National Eye Institute has some information. It's a little bit outdated, but they're working on like a 2030 data set. But the most recent information that I have gathered is from 2017. So in the US, among adults aged 18 years and older who had diabetes, 33 people per 1,000 adults had diabetes leading to visual impairment due to diabetic retinopathy. So that's 33 per 1,000, which is actually quite a significant chunk of our society, especially when these are adults 18 and over. So that's a lot of our working class too, like the working age population, and it's predicted that diabetic retinopathy prevalence will increase over the next few decades too. So this is something that, with the ADA and different organizations, it's really important to get a hold of good control of diabetes, because it's systemic body-wide issue that can lead to very, very specific problems in the eye, in the kidneys, and other parts of the body. That's why people with diabetes need to get their foot checked. They need their blood levels checked for the eye exam. And so perhaps I can introduce Dr. Reedy. So Dr. Reedy's my attending. He's actually a cornea specialist. He's a professor here at the University of Chicago. He did much of his training in Chicago, but also in Louisiana for his cornea fellowship. And he's been in practice and is very much an expert in all things ophthalmology and other things in life as well. And he, very last minute, because Dr. Ghana was in the OR, agreed to purchase paid. So he allowed me to bother his lunchtime so that we can talk to you guys together. But thanks, Dr. Reedy, for your help.
My pleasure.
And I know that you see a lot of patients with diabetes as well. It's kind of like bread and butter in your practice, as well as like most other eye doctors.
Yes.
So let's say a patient was first diagnosed with diabetes, probably like in their 40s or so, and they're sent to you for an eye exam. What are some of the things that a patient should expect from their first eye exam appointment?
Well, the first thing is that in order to see the retina, we have to dilate their pupils, and we do that with certain kinds of eye drops. And if you know you're coming in for that kind of examination, you should be prepared to be dilated, which takes several hours to reverse itself. So some people are uncomfortable driving after they're dilated. So if you're going to come in and get a diabetes check by your eye doctor, it's almost certain that they will be dilating your pupils, and you should bring somebody along with you that can drive you back home, because you may be uncomfortable driving when you're dilated.
Okay, so you do the dilated exam, and that will be after they check your vision and check the pressure of the eyes, general things for like an eye exam workup. Are there some images that people might expect to get? Any sort of special testing?
Yeah, that's a possibility. Sometimes we would take pictures in the back of the eye, especially if we look in the eye and see changes of diabetes. We might decide to do some testing or get some actual photos of the eye or special photographs to see if the diabetes is having a negative effect on your vision. So there are a number of different diagnostic tests that we can do that gives us further information about the diabetes.
Got it. And does everybody with diabetes end up having eye problems?
No, just a certain percentage. And one of the big take-home messages I like to give patients is if you can control your blood sugar, you're much less likely to develop changes of diabetes in the back of your eye. So it's all about sugar control. And the one laboratory test that we do that kind of gives an overall score to how well you're controlling your blood sugar is something called the hemoglobin A1C, which is a blood test. And generally, the numbers vary from between 5 to 15. But the medical doctors and endocrinologists recommend that you maintain a hemoglobin A1C of about 7 or below. And if you do that, you're much less likely to have not only less problems with your eyes, but the rest of your body. It's a systemic disease, and it affects a lot of other things as well.
If somebody did have kind of like not super well controlled diabetes, had sort of a high blood sugar and A1C, but then ended up over some years getting control of their blood sugars, does that necessarily mean that all their eye problems related to diabetes will have totally gone away?
Not necessarily. If certain changes that occur from the severity of diabetes can resolve with proper treatment. But there can be damage done to the retina, which is really permanent, that won't be reversed. So in those cases, we can only prevent it from getting worse. We're maybe not always able to completely reverse changes that have occurred over time.
Got it. And I know we're not all retina specialists, but if somebody did end up needing treatment, what would they be needing treatment for, and what are the treatments that they end up getting?
So the major things that occur in diabetes of the eye, as you mentioned a little bit earlier, are changes of the blood vessels. The blood vessels in the retina can become leaky, and that fluid leakage can lead to blurring of vision, something called macular edema. So leaky blood vessels can cause leakage of fluid into the part of the retina that is responsible for all central vision. So that could be what you would experience as a person would be your vision is blurry, and you have trouble reading. So that's one thing that happens. The other thing that happens is it can affect the health of the blood vessels themselves. And not only can these blood vessels leak, they can also bleed. So bleeding underneath the retina can cause problems as well. And sometimes the abnormal blood vessels grow in the back of the eye, and those can bleed or cause, say, traction or pull on the retina, so to speak, and that will also reduce vision. So we need to primarily prevent those things from happening. But if they do occur, if one of those things do occur, there are treatments that will be helpful for that, such as laser treatment or injections of special medications that cause the abnormal blood vessels to shrink and go away and not leak.
Yeah. And so I pulled up some photos here from this Ophthalmics website, just to show you what we mean by the abnormal blood vessels. Is this share screen visible right now for you guys?
Yes, that is.
Great, yeah. So these are the different stages of diabetic retinopathy. And we diagnose and stage the disease based on the clinical findings. So as Dr. Reedy said, there are blood vessel abnormalities in the retina. So what we're looking at here is a photo of the back of the eye, the retina, and the big yellow circle here that you see in each of these photos is the optic nerve. And you see these little red lines, those are blood vessels, and they are basically coming out from where the optic nerve is, and they're supplying all the rest of the retina. And so the first one, I don't know if that's super accurate. It says no disease visible. But in any case, you have essentially the retina looks kind of yellowish, orange on exam. And the blood vessels, they appear pretty even in caliber throughout the retina. And in this photo, I don't know, there's like little splotches here on the upper part of the circle. So that might be a little bit of disease happening or something else. But in any case, let's say it was totally normal. That's the actual case. You then go on to the different stages like mild, moderate, and severe non-proliferative diabetic retinopathy. And so the non-proliferative aspect refers to the fact that there are no abnormal blood vessels that are forming in the eye. And abnormal blood vessels can form in the retina as a response to the lack of proper oxygenation and nutrient supply to the retina. If the diabetes has been going on for so long and it's so severe to the point where the blood vessels that were there before are not functioning appropriately, then the body will react and try to supply the retina with what it needs by forming these abnormal blood vessels. These blood vessels are unfortunately leaky and they don't exactly do the job that healthy blood vessels would. So diabetic retinopathy first starts off in like the non-proliferative, so the non-new abnormal blood vessels stages. And so in those stages, there are the mild, moderate, and severe classifications. And so you look at the appearance of the blood vessels, and sometimes you have little leaks of blood. You can also have sort of swelling in the different layers of the retina, and that causes things called exudates that we can visibly see on exam. And with like imaging, special imaging that we can do in clinic. And then you have the more severe forms where the blood vessels look even more abnormal. And you have some appearance of the stage right before it gets to the proliferative diabetic retinopathy. So in proliferative diabetic retinopathy, that's where you start getting these new abnormal blood vessels forming. And you can also get bleeding right into the eye. So from the back of the eye, the retina, these abnormal blood vessels leak so much blood to the point where you have like sort of globs of blood in the retina, or like right in front of the retina, into the vitreous, which is the basically the chamber of the eye. It's usually filled with like a jelly-like substance called vitreous humor. And so the blood can leak into that, and that could profoundly affect vision. Diabetic macular edema is the other sort of entity of diabetic eye disease that affects the back of the eye. And that's where the blood vessels in diabetes sort of leaks a lot of fluid, not necessarily blood, but like other aspects of blood that then cause a lot of swelling in the retina. Yeah. So again, here's like no disease, no macular edema visible, and usually they have a scan here. So I was going to share this. Sorry. So here's an example right here, actually, of sort of a corresponding couple of images. You see this sort of swelling here, or these like big dark circles. That's sort of empty looking space that's actually filled with fluid that shouldn't be there. Normally on this sort of scan called an OCT, the retina should appear nice and flat and just have like little normal like smooth contours. But when it starts appearing this way, then there's definitely a problem, and depending on where the swelling is occurring, if it's in the center of the vision, it will profoundly affect somebody's vision. And so this illustration is basically showing you this blood vessel here in red. It's very abnormal, it has these aneurysms, so it's sort of ballooning out in some areas because the vessel wall structure is not very healthy. And so you just get leakage of fluid, and that goes into the tissue itself, which shouldn't be happening. There should be more selective transference of smaller molecules like oxygen and like, carbohydrates and things like that into the tissue. But in this case, everything else is just like leaking through. So that's sort of an illustration of what's kind of going on at like the more microscopic scale. Going forward. So Dr. Reedy, from the patients that you've met who have diabetic eye disease, in what ways does it affect their life?
Well, just strictly from the eye, it causes blurring of vision, so it may prevent them from driving or being able to pass a driver's test. It interferes with normal reading, so it can make reading more difficult, or in extreme examples, you wouldn't be able to read at all. Those are the major things. And then just navigation around your environment. If you can't see well, and if both eyes are blurry, which can happen, it can be just one eye, but if you're unlucky enough, you have problems in both eyes with poor vision, then you have trouble navigating around the home and around your environment, walking up and down stairs, walking over unsteady where, contours outside, like going across the street and having to step over a curb, for example. If your vision isn't good, you can trip, you can fall and hurt yourself. There are other effects of diabetes that affect different things in the body as well, but strictly, since we're talking about the eyes, those are the major things. And they're all related to decrease of what your normal vision would be.
And so if somebody does have these sort of classifications of diabetic eye disease, do they always have vision complaints, or do some people not really notice them?
Well, that's a good question. And the thing, we were talking about different parts of the retina. So most of your useful vision comes from a small part of the retina called the macula, which you noted. And if that's really responsible for all your central vision. So you need that central vision to read and do many things, like navigate in your environment. Um, we need to have that macula working normally. And if vessels are leaking in that area, and it distorts the retina, which will cause distortion of vision. So that's really the problem. It's in a small part of the retina. Now, if you have those same symptoms outside of the central part of the retina, more in the peripheral part of the retina, you wouldn't necessarily know it, and it wouldn't necessarily affect your vision that much. Or it could be early in the phase that, for example, abnormal blood vessels are growing, but they haven't leaked a lot of fluid or caused any bleeding. You may not know it. So that's the reason why the American Medical Association, as well as the American Diabetic Association, recommend yearly eye exams for everybody that has got diabetes. Because you may walk around and not know what's going on back there if something radical hasn't happened in your vision. And that's why we see patients, even if they're symptomatic or not, because if you can catch it before they become symptomatic, it's easier to treat.
And there's also glaucoma is also a very prevalent disease of the eye. Does that have any connection to diabetes necessarily?
Not directly. Glaucoma is a different thing, although there can be, if diabetes causes abnormal blood vessel growth in the colored part of the eye, called the iris in the front, that sometimes will happen, especially if there's abnormalities of the blood vessel, severe abnormalities of the blood vessels in the back of the eye. There can be abnormal vessels that occur in the front of the eye, which in turn can lead to glaucoma from the abnormal blood vessels that block the drainage system of the eye.
And glaucoma is also very progressive, slowly developing disease too.
Normal glaucoma, that's true, but with what we call neovascular glaucoma, where abnormal vessels occur, when that actually occurs, the changes of diabetes and can occur at a more rapid pace, let's say.
Got it. So I guess when a patient comes in for a dilated eye exam, they will have the retina checked as well as their optic nerve. And if the optic nerve appears in a way that's concerning for glaucoma, then we would be able to kind of take care of both and start managing both.
Now, the other issues that, if you just have diabetes in isolation, meaning you don't have any other health problems, that's a good thing. But a lot of people also have high blood pressure or abnormalities of your cholesterol, for example, or triglycerides. And if you have those two things in combination with the diabetes, and those two can cause problems in your with your retina and make those changes even more severe and lead to more loss of vision. So it's important not only to control your diabetes, but if you have high blood pressure, you need to take your medications to lower that blood pressure and keep on top of that. And the same thing goes for elevated cholesterol. So if your cholesterol or triglycerides are elevated, those components of the blood can leak out from leaky blood vessels, and, for example, get into the retina and cause decreases of vision.
Got it. So it's 12:35. I think Rebecca and we had talked about like maybe opening up the floor for like any discussions from the participants. Or we keep talking to
Yeah,
whatever.
yeah, definitely. I did see a question come through the chat about blood pressure and how it does affect the eyesight, but that was just addressed. So I don't have any current questions right now, but I am keeping an eye on the chat. And if you want to continue with your discussion, that would be great.
Yeah, sure. Other things we can talk about.
Why don't we talk about the treatments
I was gonna do that too, yeah.
of diabetes?
So, you very briefly mentioned, options of like injections or laser for diabetic eye disease. So we can talk first about, I guess laser, because those are a little bit older technology, but they're still prevalently used. So we can do laser applied to the retina. So the way we do it is we use a laser machine that's attached to a microscope, essentially, that we use to see the eye in very, very close magnification. And then the laser is basically calibrated and shot to areas of the retina tissue that we're directly seeing. And we're basically applying that laser spot or those laser spots to areas of the retina tissue that just look very unhealthy. We're basically trying to like redirect the blood flow from the blood vessels away from these unhealthy areas of retina and making them or like basically kind of shutting down the abnormal response in those areas. So people can get the amount of laser treatments that a person gets really depends on the extent of disease. And so that's what laser can be used for in diabetic eye disease.
Let me jump in here for a second. So there's two types of laser treatment. There's focal treatment, which treats specific blood vessels which are leaking around the macular region, which is responsible for central vision. So if you can identify the leaky blood vessels, which we can in a number of different ways, just doing testing, we can apply the laser treatment, which produces heat and actually closes, or you can think of it almost as cauterizing leaky blood vessels, and that stops the leakage. And when the leakage stops, the fluid that's built up in the retina gradually pumps out that excess fluid, and the retina goes back to normal, and the vision improves. So that's focal treatment. In more severe diabetic retinopathy, one of the major problems is the blood vessels kind of shut down, and the retina becomes ischemic and produces certain chemicals that are secreted that cause abnormal blood vessels to proliferate, and these can cause scarring and retinal detachment, and in additional fluid leakage, and also abnormal bleeding inside the eye. And in those cases, we would do more extensive retinal treatment. So a greater portion of the retina is treated with the laser, and that helps preserve the normal circulation for the macular region, which is responsible for central vision. So you can live without peripheral vision, but it's very difficult to get around and see if your central vision is damaged. So in order to preserve the central vision, we treat the periphery of the retina with laser treatment. and that reduces the demand of blood flow to the rest of the retina and preserves it in the central retina, so to speak. And so that's more extensive laser treatment, but sometimes that's necessary.
Got it. And so you talked about some of the molecules that cause these abnormal blood vessels to form. And I think that's a good segue into the injectable treatments for diabetic retinopathy. So there's anti-VEGF treatments, and there's also for diabetic macular edema, there are like steroid type treatments as well, right?
Right, and VEGF is a protein that's produced by different tissues when they're starved of blood. So it's called vasoendothelial growth factor. And that's what's secreted by the tissues that aren't getting enough oxygen because the blood flow is diminished. And so it secretes that as a response and causes abnormal blood vessels to form. So these newer drugs that we put directly inside the eye, unfortunately by injection, cause that secretion of this protein to stop, and that allows things to normalize again. And it's an advantage because the treatment's directly focused on the secretion of this, let's say, bad protein that causes abnormal blood vessel growth, and that stops that without destroying the peripheral retina. Because when you treat it with laser, and that's all we had for a long while, you're losing some of that peripheral retinal tissue, and that can make, let's say, things like driving at night more difficult because your night vision is not as good, and also your visual field, your peripheral vision, diminishes, because in order to accomplish what we need to accomplish, we actually destroy some of the retina with the laser to preserve the more critical central laser. And with the new treatments that we use, the injectable treatments in the eye, and there's a number of different ones that have been approved for treatment, you're not sacrificing that peripheral retinal tissue. So it helps to preserve your vision, not only in the center of the eye, but your peripheral vision as well.
All right, let's get to some questions. How often after my diabetes diagnosis should I schedule my first eye exam? Soon as possible after your diabetes diagnosis should be when you get an eye exam. It's certainly not an emergency, especially if you feel that your vision has been stable. But if you haven't had an eye exam in years, let's say, or ever, then as soon as possible appointment would be preferred, especially with a dilated eye exam. So that's very important. And how often depends on what's going on when a doctor sees your eyes. If there's really no evidence of diabetic changes in the eyes, then a yearly exam could be sufficient. But in other people, they need sometimes, like every few months or so, depending on what kind of condition they have. And what are some warning signs I should look for of diabetic eye disease? So sometimes some warning signs are not exactly noticeable. That's why you need to have a very comprehensive eye exam that looks at your entire eye with like workup, seeing what your vision actually measures at. But if you have been noticing blurry vision or just not very clear vision, distortions in your vision, it could be from a number of different things, because the eye has very many different structures within itself as well. So it could be anything from the front of the eye, dry eye, to cataract causing that vision issue, or if you have diabetes that has been an issue for you, it could also be related to diabetes. So again, you don't really know what's going on until you get an exam. But those are some warning signs that could be a sign of diabetic eye disease. And can I still develop diabetic eye disease even if my diabetes has always been well controlled? I would say I would say it's possible, but very a lot less likely if your diabetes is well controlled. Some people, even if their blood sugars have been under a good level, some people they have a lower threshold for developing eye disease related to diabetes, and some people have a higher threshold. It's a little bit hard to predict. So one thing does not always necessarily mean the other. So we've definitely seen people who have high blood sugars, not very well controlled, but with not super bad diabetic eye disease, and you have the reverse in some cases too. And can the treatments one day provide a definitive cure? What do you think, Dr. Reedy?
Yeah, it's possible. You can cure diabetes with certain kinds of transplants. The part of the body that produces insulin is part of the pancreas. There are special cells in the pancreas that produce insulin, and those sometimes get damaged. And, I think better ways of restoring the damaged cells, providing those cells, maybe using stem cells, for example, might provide a cure. Now, there are two different kinds of diabetes. Type 1 diabetes typically affects younger people, and that's an autoimmune disease where your body attacks your own tissue, in this case, those particular cells that produce insulin, and that leads to poor control of blood sugar and the symptoms and problems with diabetes. And so that usually affects young people at a much earlier age than the other more prevalent type of diabetes, which is the type 2 diabetes, where there may be some genetic predisposition. And the difference between those two in terms of presentation is type 1, the autoimmune disease that affects younger people, can be more severe at the outset, and they develop problems much more rapidly than type 2. And therefore they present with more significant health problems that gets them into the hospital and gets them treatment. Whereas in type 2, you walk around and you may never know that you have diabetes unless it's checked. That's why we go to doctors on a kind of a regular basis. And in type 2 diabetes, if you receive no treatment, so let's say you've not had treatment, it typically, the literature shows us, usually between 7 to 10 years of type 2 after developing type 2 diabetes, that's when you start to develop some of these symptoms and actual problems for example, in the retina. But it's, affects more than just the eyes. It affects the nerves of the hands and the feet, for example. So, there's a number of different things that it affects, but it takes a while for them to develop, and you may never know it unless you have your blood checked, and you see a doctor on a regular basis.
Yeah, and in terms of preventing diabetic eye disease, it comes down to the control of your blood sugars, of your diabetes, and your blood pressure, and cholesterol levels, and basically your entire body. Everything's connected to each other, unfortunately. So it becomes sort of like a very comprehensive, large-scale effort a lot of times. And how often do you see blindness due to diabetes? So I think it depends on sort of the classification of blindness. So every state sort of has their marker for visual acuity limits for ability to drive, things like that. But depending again, I guess a good blanket statement would be we see it pretty often. Vision loss from diabetes and diabetes related eye disease is quite prevalent. So the epidemiology certainly shows that 33 in every 1,000 adult people in the US have visual impairment from diabetes. So that can range from just not being able to see as clearly as you used to like Dr. Reedy said, not being able to like function, not being able to walk around safely, especially drive safely. And when it affects younger people, you know, it certainly limits their ability to like achieve achieve, you know, financial stability and goals, professional goals, personal goals, if it affects them so much earlier in life. So it's definitely a big debilitating factor in some people's lives. And yeah,
I would say you have to make the distinction of when you say blindness, what exactly are you talking about? So there's legal blindness, which is set forth by, let's say, the government, for example, says that if your vision is 2200 or less, that constitutes legal blindness. But real blindness, I think most people's concept is not being able to see anything, total blindness, black, nothing, which is the most severe form. That's pretty rare. That's a pretty rare occurrence, complete loss of vision. And it can happen with extremely severe diabetes, which is associated with chronic retinal detachment, for example, or like a stroke that involves the optic nerve, that could lead to, you know, profound visual loss. But fortunately, that's that's a rarity, I would say. It's much more common to have lesser amounts that affect the central vision, still affects your function, but doesn't cause you, you know, you can still get around and do okay, even read, but your ability is diminished as opposed to destroyed.
okay. So thank you very much, everyone, for your questions and for participating this afternoon. We'll just mention some resources. First of all, there's the ADA website, diabetes.org/iHealth. Is a website that has lots of good information for anybody to learn from. And the American Academy of Ophthalmology also has like tons of resources for providers and for patients. So the American Academy of Ophthalmology, you can search that. There's also, I think, well, iWiki.org is a little bit more for like eye providers. But in any case, the National Health Eye Institute, NEI, also has lots of good infographics that are available to the public. And the National Institute of Health also has lots of information about diabetes and diabetic eye disease as well.
I would say the big thing is be aware of your own body and your own problems. You can monitor your blood glucose at home in a number of different ways. It's a lot more accurate. And I think on the, you know, immediate horizon, that's only the ability will only get better. And monitor your, you know, if you do have high blood pressure, see your general practitioner, your internist, and to get that controlled and monitor. You can monitor your blood pressure at home. You can get these automatic devices that are very easy to use. They're not real expensive. Monitor what your blood pressure is. You know, keep a watch on your weight. Avoid, you know, eating a lot of carbohydrates, bread, pasta, all that stuff. But we say don't eat anything white. Sugar is bad for people with diabetes. So these are all things that you can do. You know, there's something called the glycemic index. Every food, everything you put in your mouth has got a number associated from 0 to 100. 100 is bad, and we like to keep things that we eat, you know, like at 50 or below. So everything you eat, you can look up on the internet and say, what's the glycemic index of this? So there's charts too. And, you know, just generally green leafy vegetables, for fruits, the two fruits that have got the high sugar content are watermelon and pineapple. If you stick with berries, you're good. If you like bananas, don't let them get overly, the riper they get, the more sugar they contain. So is all things like that, that information is out there. You're the master of your own destiny, and you can help, prevent problems by being proactive in your health. Watch your weight, eat right.
That's wonderful.
Control your blood
Thank you
pressure,
both so much
and
for
if you
joining
have
us
a
today.
cholesterol-
I truly appreciate your time. I know you guys are both very busy, and sorry that Dr. Ream couldn't join us today, but we'll catch her another time. But thank you to Humana for sponsoring our Resource and Wellness series, and be sure to check out our website, diabetes.org at iHealth for more information. And if you have any questions or need further information, feel free to reach out to me at the ADA. That's Rebecca Johnson at diabetes.org. So thank you both so much, and have a great day.
You're welcome.
Thank you. Have a good
Thanks.
one.
Thank you.